that the role of the CIO has changed totally. You know, we were software developers and architects, and we could tell you what RAM to use based on its transactional speed. Do you think any of that matters anymore? The answer is no.
Welcome to This Week in Health IT, where we discuss the news, information, and emerging thought with leaders from across the healthcare industry. My name is Bill Russell, recovering healthcare CIO, writer, and advisor with the previously mentioned Health Lyrics.
I was the CIO for a 23,000-person health system, and one of the biggest challenges was to remain current on the technology and the trends that were going on myself.
Think of artificial intelligence as a orchestra. Right now, machine learning, deep learning is getting a lot of attention, so I sort of equate that to the string section. And obviously there are many sections to the orchestra, so someday soon, hospitals, healthcare organizations are going to be able to have amazing music.
We are seeing instances of folks popping up, us included, where we're having a primary care physician set up with the dentist in the same office.
I would love to get to the space where eventually we're using voice recognition to do all of our navigation throughout the electronic health record.
When we worked at Microsoft, oftentimes, you'd have crazy deadlines. People would say, look, we're not saving anyone's life here. We can't say that anymore. And we love that. It's like we can save someone's life. We can prevent a complication or a readmission by catching it.
A lot of the feedback people are hearing about former Vice President's remarks is that he was remarkably pragmatic. And then the one that I'm most excited about, he notes that the Medicare Innovation Center, which was created by the Affordable Care Act, has the legal authority to experiment with new models to engage patients for purposes of getting better valued care.
Hyper-consumerism driving everything to a digital experience, because if we don't make it easy for patients like ourselves to use healthcare on our smart devices, companies like Apple are starting to do it for us.
I think we're right on the cusp of a huge digital transformation. It'll be interesting to see how CIOs sort of address that.
Welcome to This Week in Health IT, where we discuss the news, information, and emerging thought with leaders from across the healthcare industry. This is episode number 34. Today we discuss Epic UGM in Verona, Wisconsin, diversity and CRM. This podcast is brought to you by Health Lyrics. Health systems are moving to the cloud to gain agility, efficiency, and new capabilities. Work with a trusted partner that has been moving health systems to the cloud since 2010. Visit healthlyrics.com to schedule your free consultation. My name is Bill Russell, recovering healthcare CIO, writer, and advisor with the previously mentioned Health Lyrics. Before I get to our guests, I want to make everyone aware of a great resource for your IT teams. This Week in Health IT has a YouTube channel with great insights from industry insiders like our guest today, short segments, complete episodes, all curated for easy access. We're now up around 275, 280 videos. I have a team of millennials working to make it very easy to identify videos just on analytics or videos just on AI and those kinds of things. So check it out today at thisweekinhealthit.com/video. Easiest way to get there, or you can go to the YouTube channel and just search for This Week in Health IT. Today's guest joins us from beautiful New York City, Kristin Myers, SVP for Mount Sinai Health System. Good morning, Kristin, and welcome to the show.
Good morning. Thanks for having me.
Well, I'm looking forward to our conversation because you are freshly back from the Epic UGM conference. Couldn't have found a better person to have this discussion with, and I'm looking forward to your insights later on the soundbite section. But first, before we get going, tell us a little bit about Mount Sinai Health System.
Sure. So Mount Sinai Health System, it's an academic medical center that has 7 hospitals, over 6,500 physicians, over 300 locations, 38,000 employees. So we're one of the largest New York City employers, and, very much focused on an integrated health system and, really ensuring that we're able to provide care, from birth to, the end of your life.
Wow, 30,000 employees. I have a friend who always says that, every business is a people business, every problem is a people problem. And when you have 30,000 people, I would imagine coordinating projects, rolling projects out, communication, that's probably one of the biggest challenges for someone in your role. Well, actually,
It is.
give us a little idea of your role. I didn't really cover it. So give us a little idea of your role at Mount Sinai, and then I'll go through some of your bio.
Sure. So I oversee the application strategy and application portfolio here in the technology department. And we have over 700 applications. And that was due to the merger that took place with Continuum Health Partners around 4 years ago. And there wasn't a lot of synergies between the applications. So what we're doing now is looking at, all of the roadmaps for the applications and working out how do we actually rationalize, come to enterprise platforms, and be able to decommission some of the legacy systems.
Yeah,
so I have.
So you said 700 apps?
Yeah, we have around 700 apps at this point, and I think that our approach is really around enterprise platforms. So Epic for our clinical and revenue cycle, Oracle for our ERP, and we're also looking at a CRM, a customer relationship management platform. So I have direct responsibility for the Epic team, also the IT program management office and change management office. They oversee around $100 million in capital projects per year, interoperability, and also clinical ancillaries.
Wow. I mean, we could do a whole show just talking about application rationalization and
yes.
and platforms. I mean, platforms is the is what every IT organization is looking to get to. Platforms being open, the ability to programmatically access the information, create workflows on it. So yeah, those are some interesting. And I'll look forward to. We're going to talk a little about CRM a little bit later. So Mount Sinai for about 14 years, PM at Capgemini, but you started your career in Australia. Clearly, that is not a New York accent that you're sporting there. And you did spend a couple years with Cerner, although I think we're going to find out here that, well, we already found out that you're an Epic shop at Mount Sinai. So
that's correct.
So one of the things we like to do with our guests, and just open it up and say, what's one thing that you're excited about or that you're working on today that you just want to share?
So I'm working on the customer relationship management strategy here at Mount Sinai, and that's really exciting to me because being able to understand our patient population and have a 360 viewpoint on all of our patients, I think is so important. And how do we personalize how we are able to communicate with them? What are their preferences in relation to text or email or phone? I mean, knowing that and being able to actually engage them in a better way, I think it's important for health systems to be able to have that knowledge of the consumer. So that's what I'm working on today. We're going to be releasing a CRM RFP in the very near future. We have CRM already implemented in pieces of the organization, such as marketing and our population health group and business development, but we're looking for one platform across the enterprise. And, the use case was really around the access center. And, how do we provide our call center agents with one platform so that they're able to see, whether it's a patient's birthday, how they want to communicate, what was their experience at, one of the physician's offices? Did they make a complaint? Did they have a great experience? What are the Press Ganey scores? All of that. I think it's so important.
Yeah, absolutely. CRM is interesting. When we took a look at it at the health system where I was CIO, you did have we had multiple CRM systems in place. We had some clinical systems that were trying to do CRM type features. And then we had call center systems that were trying to do some CRM type features. But when you try to orchestrate a patient experience across, 15, 20 different systems, that it was hard to move every patient touch point across there so that everyone sounded like they at least worked for the same company. And I assume that's one of the challenges that you guys are facing.
Yeah, and I was reading actually some of the Gartner reports around CRM, and only about 20% of health systems that actually are implementing CRM are able to get an enterprise solution. And I think the challenge is, who is the operational owner? It touches nearly everyone in the health system. So I think getting that sponsorship around, who actually is going to be, driving these decisions is problematic at many health systems. So, we've been very lucky that, our executive team clearly understand this is a priority, and, they've, really supported the ability for us to, go to RFP and have an enterprise strategy.
Yeah, well, that's great. So on our show, we do two segments. We do In the News, where we each pick a story to discuss. Today, we're just gonna focus in on the conference and talk about different aspects of that. And then we do a soundbite section where more of an interview type thing, just ask you a couple of questions, which we've discussed ahead of time, so people don't think I'm just gonna try to stump you here. So in the news, I'm gonna have you kick us off since you were there. Give us some idea of, what was, I assume it was a festive kind of mood, and what was the atmosphere, and then what were some of the key themes and topics from the conference?
I've been there at UGM for the last 13 years, and this year was a great experience as usual. It was a great outdoors theme, and I think one of the focus areas for Epic is around patient experience and access. And so I was really pleased to see at some of the usability sessions, the focus on their MyChart, which is the patient portal, and how they are ensuring that the mobile version of MyChart is exactly the same as the web-based version. I mean, we've had some issues here where, we have initiatives such as Open Notes, where we're being very transparent about, the progress notes that the physicians are writing on MyChart, but that can only be seen on the MyChart desktop, not on mobile. And, many of our patients do not have access to either the internet, and they're not able to see that version of MyChart. So they only have the mobile version. So I think the ability to have all of the functions consistently is going to improve patient experience dramatically. They've changed the look and feel. I mean, clearly there is a lot more focus on user experience and how to engage the patient. So that was a pleasant surprise that they're really moving in that direction. I was pleased with that.
Yeah, that's awesome. The mobility, the numbers continue to stagger me. I mean, just case in point, this podcast, 90, I think it's like 95 to 97% of all listens will come on a mobile platform. Hits to the website is almost 95% from mobile phone as well, which actually, I'm not surprised that it leans in that direction, but it's a little high for me, considering that a majority of our listeners are healthcare users, and healthcare users generally are web type users. But that's just the transformation that's going on. People are mobile, and so everything we do now in IT has to have a mobile component for how you're going to show notes, how you're going to show the medical record, how you're going to do scheduling online. So that's really fascinating. So I'm going to tee you up. And I'll tee you up with some of the articles that have been written, some of the tweets that are out there. We're going to look at four main things. So some of Judy's comments early on, this is really around innovation and startups. Faulkner acknowledged that there's a lot of buzz around digital health today. Many leaders in hospital IT departments have words like innovation, have titles like innovation, analytics, digital, data in their job titles. She said most of the titles barely existed 10 years ago. I assume you're seeing these kinds of titles emerge. Do you think, are you seeing that people with these titles of Chief Innovation Officer and Chief Data Officer or Analytics Officer, are these reporting into IT? Are you seeing them outside of IT? And what kind of models do you see sort of emerging around these new titles?
No, I think that, healthcare, as you know, I mean, sometimes lags behind, the rest of, the industries such as retail, et cetera. And, this has been going on in those industries for quite a while. And, so we're seeing chief digital officers and chief data officers, in the business at other health systems. We recently actually were able to, hire a vice president overseeing consumer digital, and that person is in the business. And I think that that is a model that you're going to see more and more of, not necessarily in the IT department.
Yeah. Yeah, I think we are seeing them. Well, we're seeing a lot of different models. That's why I put the question out there. I mean, we are seeing it really tied to the business. We're seeing some in IT, and then we're seeing some departments that are purposefully being kept separate, so that the I think how Rod Hochman described it is so that the organization, the culture of the organization, doesn't crush innovation. Is how he described it.
Yeah, I mean, we're very lucky. I mean, we're an academic medical center, and so, we have a lot of innovation occurring, not just within the IT department, but, also in operations and also in our research and genomics division. So, there's a lot of innovation occurring here, and, that's what makes it exciting. And you're able to partner with these teams and actually, work to get, great solutions out there.
Yeah, and so, which is why I find these, so innovation and startups, so Judy went on to say, there's so much money in Silicon Valley for startups. When I go to an innovation conference, I feel like a piece of meat walking around dogs, and I like dogs. She goes on, these are I just found these, it's kind of comical. I assume people laughed at that. Startups sit at one end of the spectrum of the technology business. At the other end are giant gadget and software makers like Amazon, Alphabet, Apple. In addition, Faulkner mentioned IBM, Microsoft, Netflix, Walmart, among others. We've talked about others on this show. It's too early to say how they'll fare, but some big companies from outside the industry have struggled to impact healthcare in the past. See Google Health and Microsoft Health Vault Insight. Faulkner said in her keynote that it's hard to make meaningful advances in the area of as complex as health IT. And then she went on to say that the EHR is the most complex area in the world, which is health, operates in the area that's the most complex in the world, which is healthcare. She said, I think it's more complex than rocket science. Is Epic saying, look, we're in your corner? They're saying to this crowd, which is, health systems, we're in your corner. Our intentions are good. We've made good progress together. Don't look somewhere else for a shiny object to solve your problem. Their intentions, the Silicon Valley people, may not be good. They failed in the past, as has been noted. This stuff is really hard. Do you think these comments are a form of, of FUD, of fear, uncertainty, and doubt around startups and tech companies, because they are starting to capture some attention within this space and do hold some promise? I mean, what do you think her thinking was behind really those feisty comments about tech startups and the established players?
I think she's concerned around some of these applications not being HIPAA compliant, and I think that we're all aware of what's gone on with Facebook and Cambridge Analytica, and I think that her concern is around patient data and making sure that patients aren't being directed to inappropriate services, or that their data is being shared in a way that clearly that the patient doesn't understand, and that they're being subjected to advertising, etc. So I think that was probably one motivation. I think the second would be around fragmentation of workflow. And I think that is one of the challenges as it relates to digital health, is how do you incorporate these applications in such a way that it actually makes the workflows more efficient for our physicians and our other providers and nurses, and within a hospital system or a healthcare system, but also from a patient access system and the consumer experience. Just putting apps out there is very confusing for some of our patients. I think that, there needs to be an intentional, comprehensive strategy around how do consumers and our patients actually access care at health systems. And it needs to be a very seamless experience. And not a lot of healthcare systems are actually doing that, from my opinion.
Yeah. So this wasn't one of the topics I was going to take you down, but I assume there was a lot of conversation around physician burnout and making the systems easier to use. I mean, what were some of the things that you heard around that topic?
Yeah, I think, physician wellness is a huge issue. And in fact, we have a chief wellness officer at Mount Sinai, and we've really aligned some of our optimization efforts with his efforts also. I think that, the way the systems are implemented at times, there's a lot of ways to be able to achieve, the same workflow. And there needs to be an emphasis on simplicity and efficiency and making sure that, the physicians and, their support staff, really understand, the tips and tricks and the shortcuts to be able to get through their office visit in the shortest amount of time. And, I think that's been an emphasis from Epic. They've been, very much focused on this and, been great partners working with us on our own optimization efforts.
Yeah. And a lot of the challenge, 30,000 employees, not all of them use the EHR, but what we found in having physician champions around the different hospitals was there were some physicians that were using the system so poorly, they hated the system, but when you sat there next to their elbow and said, hey, did you know this was available? Because they didn't have time to go to the full training, or they didn't have time to do that. A lot of it was just training and communication of how to use the system better. And it just takes time to propagate that.
Well, and that's the challenge for us is, we have over 6,500 physicians in our health system. And so, we're taking a two-pronged approach. One is to have optimization teams go out to the practices and actually, shadow the physicians, which we find is pretty much the most effective way to teach them at the one-on-one, at the elbow, these shortcuts. But we're also taking an approach of trying to push content out in an enterprise way and, deliver these 10-minute videos that are very quick that they can watch around these shortcuts and, going to their departmental meetings. But, it's a huge amount of work. And I think that it's labor intensive, and trying to find different ways of being able to, do this at scale has been challenging. So we're looking at, developing the power users in the departments, getting more physician builders out there who can really work with the departments, not independently completely, but, have a lot more autonomy. We'll still have governance, but we need to be able to get more of this configuration work out there in the department.
Yeah, absolutely. So getting on to the next topic. So interoperability. Judy said, enabling seamless data visibility across Epic customers via one virtual system worldwide would improve patient care and allow for idea sharing that could lead to medical breakthroughs. Epic is working to take interoperability globally. Judy told the attendees, let's see, she goes on to say, you've eliminated the silos from within your organization, said Faulkner, speaking at the conference. Now it's time to eliminate the silos from outside. Faulkner was referring to Epic's One Virtual System Worldwide initiative, which it launched early this year. The initiative enables clinicians across all organizations using Epic to more easily gather, share, and interact with health data, no matter the location, and presents it in a unified view. So I'm gonna spin this a little bit. Let's take this from a different lens. Interoperability, as we've talked about, is really good for patients. We believe it's good for patients. How do you think you and I as patients will benefit from one virtual system worldwide? And are there any risks or drawbacks to us, the patient?
Well, I go back to not every organization has consent implemented in a way that allows a prospective consent, meaning the ability to share that data. And I would also say that many EHRs, especially in the ambulatory setting, don't necessarily have the capability of being able to share that data in a real way. There's a cost associated, especially for voluntary physicians that, they may be solo practitioners or, a very small practice. And having the ability to actually share that data with large hospital systems can be very, very challenging. So I think that, while I, share the vision from an Epic standpoint, I think that, on the ground, there are a lot of challenges surrounding this. When you're, I was going to say, if you're, working at an Epic to Epic site, it's amazing. I have been a patient at different Epic sites, and the ability for, the physicians to be able to see, the data from the other sites in a prospective way has been fantastic. The challenge is, when you're going to these small voluntary offices that, don't have that ability to share the data. Yeah.
I was with a Kaiser physician last night, Kaiser Permanente, and I was just asking him, what's been the biggest challenge and benefit to the EHR? And obviously he was just talking about within Kaiser, but he said, he goes, once we got it implemented across the board, he said, it's amazing how much time it saved, how much it organized the care protocols. But he said, but for the patient within this Southern California market for Kaiser, he goes, we just, the communication is so good, and the patient experience has gotten so much better because they, he goes, I am aware of all the tests that they've had. I am aware of their history. I'm aware of whatever. And so if we can create that across health systems, that's great. And as you said, for an Epic to Epic shop, I don't have to worry about, does my health system have a good HIE strategy? Do they have a good mechanism in place? And, at least from that standpoint, and even, Cerner has their ability to do that across their partnerships. But it would be nice to see that across all the EHRs. And I think that's what and Judy actually noted that they do share across multiple EHRs with that platform, utilizing FHIR standards, I believe, is what she was talking about.
Yeah, I think, there are organizations, other vendors like Athena Health that are, really progressive. I think that, they actually, Epic and Athena Health have, the ability to exchange health records very easily. And I know Epic has exchanged records with many, many other EMRs, but it's unbelievable, but there's still EMRs out there that it is problematic to share some of the data with.
Yeah, and we're not going to mention any names here on those difficult. No. There's no wall of shame. So, research and discovery. I thought this was one of the more interesting and I think hopeful things that was talked about at the conference, and that's what Epic is calling Cosmos, and that's the world's largest clinical database of information, de-identified information that can be used for research and research purposes, which I assume as an academic medical center, this is a huge benefit to organizations such as yours and the Biden Cancer Initiative and other things like that. I didn't get much from the stories that are out there. I assume this is more like aspirational at this point. Were there a lot of details shared? I guess I should just ask the question on what Cosmos is going to do, when you can have access to it, and who's going to benefit from it.
I did not see a lot of information shared. We had our chief research informatics officer also attend the session, and from that we decided that we're going to bring Epic on site for a deep dive with our research community, because the information that we received was light on detail at this point.
Yeah, but it is exciting. I mean, to have the more information that's available to researchers such as the ones at Mount Sinai, it really is going to benefit. I think it's going to benefit humanity that we, just have better research being done based on the data.
I mean, the ability to share de-identified data amongst other institutions and being able to collaborate that way is going to improve research exponentially, I think.
Yeah, and there's a lot of arguments over how and who benefits and where does the money go. And we're going to avoid those in this because you have a hard stop, and I want to get to the other question. So safety and privacy, the last thing, she mentioned Zuckerberg going to the Hill, Cambridge Analytica. You mentioned it earlier. So Epic plans to develop tools that when third-party software applications, healthcare providers and EHR vendors, being the other parties, ask patients for permission to access their medical records, Epic can tell the patient what the application is likely to do with their information. So Epic's going to act as this sort of gatekeeper to say, hey, what are your intentions? And then they pass that information along. Critics of Epic have previously called the company's software a closed platform and argue that software was limited in its ability to easily exchange data. Echo has muffled some of those critiques by configuring and keeping tools to be able to share information. They're a participant, obviously, with Apple's Health Kit. They participate with Fire. They have open API. Well, they have APIs through App Orchard. Let's see. Social norms have changed, and if patients want to share their data, they should be able to, said Sumit Rana. However, Rana said that a typical medical record not only contains identifying information about patients, but also genomic data and information about their family and family history, for example. Above all, people should keep in mind that long-term consequences of clicking I agree on a computer or smartphone app's terms and conditions screen. And she closes out by saying, consider the implications of uploading the protected health information of a minor. As an adult, they could be very upset to find that mom opted to share their personal data with an app 20 years ago in exchange for bonus points on their favorite game. So how was this received at the conference? I'll give you, just some things that I've heard from the development community. But how was this received, and what are your thoughts? How was it received at the conference, I guess?
Yeah, I mean, for the people I spoke to, I think everyone thought that, Epic's intentions were really good. I think the challenge is going to be around, the vendor reaction around this. And, are they going to be collaborating with Epic long term if this is the way that, Epic is going to be working with the third party? So, I think more to come on that, but I'm interested to hear what you heard from the development community.
Well, it's interesting. The development community is scared of Epic. So so I get these comments and I'm like, so do you want to come on the show and talk about this? And they're like, no, I don't, if I come on the show and talk about this, it could decimate my company. So I'll just share what I've heard, and really no commentary on it. The foundation for this thinking is that, the patient needs to be protected from themselves, or better yet, that the patient no longer holds sway over their record because it really holds information about the family. If you get my DNA information, if you get my genomics, you're really getting information about my daughters and my son, and I'm sharing that information, or I might share their information when they're a kid. So it's an interesting new take, but the foundation is we need to protect you from yourselves. The fear factor. Being you don't want to be, the fear factor that she sort of laid out there was you don't want to be the next one on the Senate floor like Mark Zuckerberg, sweating while you're getting grilled, and it really is a fear factor, and it's brilliant marketing also, sort of pushing people in the Epic direction. But here, what I'm hearing is it really places the attendees in a position of, first of all, they feel like they're doing the right thing. They're protecting the patient by limiting their options to access to data. And Epic now acts as the ultimate gatekeeper in the role. You want to innovate on our data, you have to ask permission, pay the toll, and we'll determine if your intentions are nefarious. Oh, and by the way, if you read Epic's agreement, nefarious can be defined as bad for the patient or just bad for Epic. If it's competitive to Epic, it can be bad. And so these are the things I'm hearing from the development community, which is, okay, so now Epic controls that data. And it's not really Epic's data. It's the patient's data. And if it's not the patient's data, we can argue that it's the health system's data. At the end of the day, there's this is a very nuanced argument. I get both sides. I get Judy saying, hey, look, we've got to create a mechanism where people know what they're agreeing to. We don't want them giving away information to bad parties. I get that. I get Epic's intentions, but I also hear the development and innovators saying, hey, wait a minute. Do you realize how much I have to pay Epic to get access to this data? And when I do, I have to follow their rules, and I can't compete with them, and they could easily come out with something that crushes our company in 2 years. So I hear both sides of it. I don't have an answer. I'm just sort of teeing it up, I guess.
Yeah, and I also think, for the academic medical centers that, are, doing their own innovation and, working on their own products that they ultimately commercialize, such as Mount Sinai, we're going to have to work through that with Epic. And, how does it impact us as an innovative health system and, as well as other third parties? Because sometimes Epic does differentiate between, the health system innovation and the third-party vendor innovation. So that will be a nuance we'll have to work through with them. And, the devil's always in the detail with Epic. And, they do listen to customer feedback. So it'll be a topic that we engage them on pretty quickly.
Well, we're going to get into the questions, but just so people don't think I'm wishy-washy, I've been very clear on this. I believe that the patient owns the record. I believe, regardless of if we can trust the patient, it's not really Epic's place to protect me from myself. It's my data. It's my health. It's my children. I don't want the government that tightly overseeing what I do. I definitely don't want Epic tightly overseeing what I do. I've been on the record as saying that. I just don't want to come off as wishy-washy. But with that being said, I completely understand Judy's intentions of protecting my parents who don't know technology and can click on things. I get it. I understand where they're coming from. I don't like it, but I get it. It's a very difficult problem to get. So let's go on to the questions. There's a quick section. Shorter answers are great because we're going to cut these up into videos and put them out there on the YouTube channel and out on social media. So 5 questions. Let's just we'll rifle through them. First question: what are some of the new business models you're seeing within healthcare and that are really changing healthcare at this point?
I think that health systems are moving in a direction of being, integrated, outcomes-based, and, being able to, really support empowered consumers. And it goes back to some of the topics we were talking about earlier around, mobility and customer relationship management, and how do you engage, the patients. And, I think that health systems are going to be exploiting digital platforms ultimately to support these business models.
Yeah, absolutely. So second question, what are some of the digital trends that you're seeing within healthcare?
So we talked about mobility, we talked about CRM, definitely telemedicine. There's a lot of trends in machine learning, predictive analytics. We actually had, the head of our data science team do a great presentation at the Epic UGM, Robbie Freeman, on some of the predictive models that Mount Sinai has developed independently of Epic and then ingested it into Epic around sepsis. So I think that that's definitely going to continue to be a trend. Wearables, blockchain, I think that they're probably, the major trends.
Yeah, I was also at a conference this week. I was actually just at one day of a conference this week where I got to hear the head of NVIDIA talk about AI, and it was fascinating to me to hear. One of the I think more fascinating things that he said was, that the next generation of data programmers are going to be the data scientists, not necessarily programmers that write code, because the AI itself is going to write the code. But what you're going to do is you're going to present the data to the AI in a way that that is the person that's really going to dictate how new algorithms and new code gets written. And so I think the combination of all these trends, digital trends that you're talking about, is going to be really exciting and impactful for healthcare.
I agree.
Third question here is we see some health systems investing in CRM. So let's go into the CRM conversation a little bit more. Where do you guys see it? Where do you see it fit within your health system? And actually, I'd love to hear you answer the question of, who does own it within a health system? I mean, that has been one of the more interesting challenges. Is it a marketing initiative? Is it a pop health initiative? Is it a medical group initiative? Is it the call center initiative? Where does it fit in healthcare, and who owns it?
Yeah, I don't think that it fits into one particular group, and that really is the challenge. I think that, it all comes back to governance. And so you've got to be able to, work with, a number of sponsors. So in our case, it is the Chief Strategy Officer and also the Head of Population Health and Ambulatory Care who are driving this initiative. But again, we've got governance that brings in every group across the health system to engage them. So we have, marketing there, network development, our access center, hospital operations, all represented in this governance model. So, I think that we've got the right engagement. But again, this is why enterprise CRM sometimes fails in health systems, because there isn't one owner, as you correctly identified.
Yeah, and so you're going to have your EHR, you're going to have your ERP, and now you're going to have CRM, and these are going to form a pretty strong platform foundation across the board. And as we become more customer centric, I see a lot of health systems looking at CRM. I don't see a lot of them implementing CRM on an enterprise scale. So we will definitely check back with you after you get done with the the RFP and see how the implementation goes, because I think a lot of people want to hear success stories around how it gets done.
Absolutely.
So fourth question: what challenges are you seeing IT departments face, and how do IT departments really need to adapt or change? Do you think?
Yeah, I think a few areas. One is, many IT organizations are built in a functional model. And, I think that, they're organized in that way and not necessarily aligned with a service type model, which is aligned with the business. And I think that, sometimes organizationally, it needs to change to be more aligned with the business. And I also think that the competencies and skill set of, people in the IT department is changing rapidly. And we talked about all of those digital health technologies and, trying to get the technology teams up to date on what's going on in the marketplace and educated in these technologies. And again, giving them other skills. I think that the soft skills around emotional intelligence, communication, understanding strategy is going to be more and more important as time goes on. And, many organizations are going through this where, infrastructure and legacy applications become commodities and become managed services or even offshored. So, we need to focus on where the value is, and the value is with the business.
Yeah, it's interesting, and this is becoming a recurring theme. So Ed Marks from Cleveland Clinic talked about embedding IT in the stand-up huddles, and I know that Dr. Anthony Chang, when he was talking about AI, talked about how his analytics teams is in those lean huddles and does rounding with the physicians as well.
Yep.
And
we have the same. We have business relationship managers that are rounding with hospital operations every single morning at every site.
Yeah, it should become harder and harder to identify, who the IT people are and who the business people are. And we're seeing a lot of clinicians, head in this direction of an analytics career path, or making sense of the EHR, or even programming the EHR. We're seeing a lot of people take that degree and head in those directions. It's fascinating to watch. And this is a topic I want to give you some time on, because I know that you're an advocate for women in leadership and diversity. We talked about this the last time we were on the phone. Why do you think diversity is so important to promote? And I think the follow-on question for me on this is going to be, what's some advice that you would give women in healthcare IT at this point? So why do you think diversity is important, and advice for women in health IT?
So I think, diversity is important. We need to have different opinions at the table in order to solve really complex problems. And as you know, in healthcare, and specifically in IT, we've got a lot of complex problems to solve. I also think that, at the leadership level, we need to have representation of our patient population. And when you think about it, 60% and above of healthcare decisions are made by women. And so that's why I feel, pretty passionately that, the leadership has to reflect, our patient population and where the decisions are being made, in order to engage our patients also. And, I'm very lucky to be working at an organization where, we have great examples of strong executive women. We had a number of them recognized recently in Cranes. And, we're also the #1 health system, according to Diversity Inc., for diversity and inclusion. And we've got a great diversity and inclusion program here. So again, an honor to work at Mount Sinai.
Yeah, and well, that would have to be the case in New York City. It is literally the epicenter of a melting pot. Your patient community is very diverse, and your care community is. Is there anything any advice you would give to women? I saw a post, I think it was a LinkedIn post, where a health system team said, just finished our strategy session, setting our strategy, whatever, great meeting. And the picture had a picture of all the people that were attending. And I kid you not, I think it was like 14 men and 2 women. And I thought, that's problematic. But what's your advice to women to get more women in that executive level, seat at the table talking about strategy? How are we going to do that?
Well, I think, ultimately it starts with the recruiting and the pipeline. And, if you are an executive, it doesn't matter what gender you are, and you're receiving the same resumes over and over, the question is why? And so you've got to go back to HR, and you've got to look at, the pool of resources that you're trying to pull from. And that's not just for gender, it's also for underrepresented minorities. And, so I think that that's where it starts. I would also encourage, female leaders to engage the men in their department as allies, because just having a discussion with other female leaders is great. And I think that, it helps other women in the department, but ultimately we have to engage the men in this endeavor. So if there is, a room full of men, I think that, the question would be, where are the women? And I think that, women leaders and men leaders need to bring in other women into the meetings, even if they're, directors or senior directors, just to give them that exposure, give them the seat at the table and hear what their opinions are. And I think if more and more happens like that, we'll get some progress. And I also think mentoring is huge.
Yeah.
I know that, sometimes it's a challenge for women. I've heard many, many women say they've not been mentored by a female leader. So I really encourage mentoring at our health system. And, we've got a great program here. But I would encourage, other health systems and hospitals to have a mentoring program and have women-to-women mentoring. It helps.
Yeah, be a mentor, seek a mentor, and I think that's a great way to end the show. Kristin, thank you very much for coming on the show. I know you're very busy coming back from the conference and then your first day back in the office. Are you active on social media at this point?
Mainly LinkedIn.
Mainly LinkedIn. So people could follow you on LinkedIn.
Absolutely.
Not too hard. Kristin Myers, Myers at Mount Sinai Health System. Find her on LinkedIn. Click follow, and you can see what things she's talking about. You can follow me at the Patient CIO on Twitter. You can follow the show at This Week in HIT. You can check out the website, thisweekinhealthit.com. Catch all the videos on the YouTube channel that we talked about earlier, thisweekinhealthit.com/video. And don't forget to come back every Friday for more news, information, and commentary from industry influencers. That's all for now.